Welcome, everybody, to the Thursday study group. Um, Today, I'm joined by my partner in crime here at Buddy on the marketing team, Joe Filipenko. Joe's going to help keep me honest. I'm Gretchen Berry, the Chief Marketing Officer here at Buddy. And today, we are privileged to also be joined by John Thomas of Amada Senior Care. And I'm sure any of you who have spent more than 60 seconds with Buddy has probably heard of Amada. So John has been kind enough to join us today and give us the sort of briefing on what Amada does for us as a preferred community partner. And so, John, I'm going to just let you sort of take it away.
Wonderful. Well, thank you, Gretchen. I appreciate the introduction and the opportunity to share with all of you. I see a couple of friends and friendly faces on the screen here. So good to be with you all. For those of you that don't know Amada, welcome. I'm glad that you're here and happy to be able to share. We've had a great partnership with Buddy Insurance. Buddy Insurance is become our go-to partner for long-term care insurance planning. And it's been, I've known Mark for years. Before joining Amada, I was a long-term care insurance wholesaler and knew him out on the circuit, and we would connect even before Buddy was started. But as our organizations have grown, we're growing together, and so it really is a privilege to be here with you all.
John, are you also an actuary?
I am not an actuary.
I thought, how did I? Okay, I thought you were. That's how I thought you met. So I was wrong about that. So I learned something.
No, no. I'm curious. I'll put it that way. I'm curious, and so I've always asked. At every insurance company I've worked for, I asked a lot of questions of our actuaries and our underwriters. And
so you're actuarial curious.
That's right. That's right.
Okay.
So that may be where I connected with Mark.
Okay.
But yeah, I'll share my screen here. I would love for this
Yeah.
to be a conversation, though. I know some of you know Amada and you know who we are. Those of you that don't, absolutely feel free to ask questions, interject Gretchen and Joe and Wendy where you have some commentary or you have questions, or you see that questions come up in the chat. But I am open to questions and feedback as we share here. But I'll share my screen. Okay, how's that look, Gretchen?
Fantastic.
Fantastic. Wonderful. Well, I will give, really just, and I have some slides prepared, but I'll give a little bit of background for those that don't know Amada and don't know our story, and then talk a little bit about the industry, really senior care and home care. And I think those are pertinent when we talk long-term care insurance because, the truth is most folks want to age in place and they want to stay home. And a majority of care is taking place at home. I may touch on Medicare a little bit and some changes in Medicare and Medicare and government, as a payer is pushing more folks home because care at home is less expensive than communities and facilities really where whether that's nursing home or skilled nursing facilities, right? And so a lot of care is taking place at home and folks want to stay home. And so home care is a big part of the overall care continuum and the conversation when we talk long-term care planning. But before we jump into that, I mentioned that I work for a couple of insurance companies. I think I'm going on, I don't know, 20 years in the industry, financial planning industry. I started out in retirement planning with an insurance company and then got into life insurance wholesaling and then long-term care. I was going through a care event in my own family. And became very, very acutely aware of the challenges with caregiving. And so that led me down a path of becoming passionate about long-term care insurance, like many of you have. And I know those of you that are in a broker or in the group planning space, maybe it's not completely all of what you do, but you're in this group of long-term care enthusiasts and specialists for a reason, right? Because long-term care is a part of what you do and you're learning or you're becoming passionate about it. And so I started down that road of becoming more passionate about long-term care insurance and did that for a number of years. And then a few years ago, I started seeing number of claims, right? As I was working at the insurance company and I saw claims coming in the door, and long-term care insurance claims were not happening like I thought they should be happening, right? They weren't as easy. The process wasn't as smooth. I identified a lot of challenges, and I was working with those companies to try to work through those challenges, but there were inherent obstacles in the process. And so I started talking with the CEO and founder of Amada Senior Care around that time. And he convinced me that there is a better way for payers of care and providers of care to work towards a new model together. And so a little over 2 years ago, I joined Amada really to work with insurance agents, agencies, BGAs, brokers, right, who are providing group benefits, and insurance companies directly around really building a model of cohesive care from the payer source or the claim right through the end care experience. And so that's my background. The company was started in '97 by Tafa Jefferson. He's the son of a caregiver. His mom was a caregiver, right? And he always tells us stories of his mom bringing seniors around the Thanksgiving table or Christmas table, right, when he was a kid. And so he really fell in love with seniors and saw his family's passion for caring for the elderly. And he went off to play football. He says he caught a cup of coffee with the Bears in the NFL, and he had an injury and was booted from the NFL after that injury. But he was looking for what to do next, and because of kind of his raising, right, he started off in senior care. So started a senior care company in Southern California in '97. By '98, he had his first long-term care insurance client, and he really became passionate about the power of long-term care insurance and making care possible. And so we as an organization, really established ourselves as experts in long-term care insurance claims. That led to some innovations in technology and managing claims and technology for our clients. And to that, around 2012, we started franchising our business as long-term care insurance experts. And then in 2025, we have 250 active or open offices around the country. We've got, I want to say 40 that are on their way to opening. We are close to 300 agencies around the country. We probably
Guys,
process 30,000 claims this year.
yeah, you guys are growing like crazy right
We're
now.
growing a ton. We're growing a
Yeah,
ton.
that's
And
awesome. Yeah.
a lot of that is the need for care, right?
Hmm.
Um,
Right.
we are, I'm excited to tell you we're the fastest growing home care agency in the country. But the entire, industry is growing because there is a significant need for care.
Hmm.
As baby boomers are aging, I know all of you have heard of the silver tsunami that's coming. There's also a long-term care insurance claims tsunami that's upon us, and really increasing the demand for care. So we're throughout 45 states. We're not in South Dakota, Hawaii. Well, no, excuse me. We just recently opened agencies in South Dakota, Hawaii, and Connecticut. We are in New York delivering some senior care services, but we don't have full-time agency support in New York. There are some limitations there, and we're not in North Dakota, Montana, Alaska, to kind of give you some framework of where we are and where we are not. And the services that we deliver, we are a full senior care advisory agency. And so we offer up a number of different services, but our primary business is home care. And so we provide the kind of care that long-term care insurance pays for, right? That's ADL support. So helping seniors, providing caregivers in home to help seniors live their lives independently and be able to age gracefully and stay home. So those are things like helping seniors get up and get dressed in the morning and get out of bed and get bathed, making sure they have transportation, can get to the doctor, right? Get to the salon if they'd like, and go grocery shopping, making sure they have meals and they're eating. So we have those in-home caregivers, and that's our primary business. But we also understand that care is a continuum, right? And everyone can't stay home forever. They may their needs may change to the point where they need to go to a memory care community, right? Or assisted living makes more sense, right? And so we help place folks into the right environment that might include senior living or a senior community. Um,
That was the trajectory for my mother. I mean, she started
mm,
out with home care,
mhm,
and then went into assisted living.
mm,
Now we just happened to like be very familiar with the area, so we kind of knew exactly where we wanted her to be. But had I not known that, being a long distance caregiver, having access to Amada would have been just a huge, huge help
mm.
to help identify those facilities and caregivers.
Yeah, and Gretchen, that is pretty common. I think most care, as I said, is a continuum, and a
Hmm.
lot of folks' needs get to the point where either it's not safe to stay home, or their medical needs advance to the point where they do need on-site, an on-site doctor or
Right,
on-site nurses, and so a
right.
senior community makes a lot of sense. Um,
Yeah.
and then from a long-term care insurance standpoint, right? Once you exceed a number of hours at home, right? If you need, let's call it 15 and plus hours of care a day, right? 7 days a week, it may be less expensive to live in a community, right? And so
Yes.
your long-term
Yes.
care insurance has a certain maximum benefit, right? Maybe it makes more sense to transition. So we take all those things into account and help folks make the decision that is best for their overall care plan, but then also their financial plan. And so uh, go ahead,
Can I
Gretchen.
ask you another question that's
Please.
related to that? So,
Mhm.
and you might cover this later, but
Mhm.
so is it your experience that if somebody if somebody has even if somebody has just a like the minimum amount of long-term care insurance, is it your experience that these providers will sort of um, look at maybe embrace them more than they
Mhm.
would with somebody who's coming in with like without insurance?
It's a great question. In theory, yes. Yeah, especially if you're on a wait list,
Mhm.
especially if there's a shortage of beds, let's say, or rooms in a particular community, right? If you have the means to pay for care, right, and you
Mhm.
have insurance or you have significant assets on paper, you know, those folks that are not going to struggle to pay, it's unfortunate, but folks that are not going to struggle
Right.
to pay, they're not paying out of income, and if they have fixed
Income.
income,
That's yeah, 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 yeah.
right, then you can be bumped higher in priority, right, in
Right, right,
specific
right.
communities. So
Okay.
yes, now in practice, that is true. In practice, I will tell you, most communities, most home care agencies do not know how to process long-term care insurance, and they often do not help those folks with their long-term care insurance claims. And so we actually do a lot of work on behalf of other communities, on behalf of other senior care agencies or home care agencies that are, aren't in the practice of filing and managing claims for their clients because they don't have that expertise. So sometimes it
Mhm.
puts folks in a hard position because they assume that their provider will know how to manage their insurance. Most people think about it like health insurance. They're like, well, I don't really have to think that hard about my health insurance. I tell the doctor what insurance I have, and the doctor handles it, or the clinic or hospital handles it, right? Most consumers think long-term care insurance is a lot like that. They don't really realize that providers are not engaged in managing long-term care insurance, and it's really on them, unless they're paying for some sort of concierge service for their claim, or they use a service like ours. So
Right.
that
I
can
see.
sometimes put families in a hard spot. Yes, they have
Hmm.
insurance, but their provider may not know how to manage it.
Hmm.
Yeah.
Good point.
And so we round this out with financial assistance. We really believe that, it's not only our mission to provide care coordination, make sure folks are receiving the kind of care that they want and deserve, but also that we help them find all the resources possible to help pay for care. So that's, of course, long-term care insurance. It could be VA. A lot of our business is working with veterans. And so we're licensed and contracted with the VA across the country. We also kind of try to tap into whatever other resources they are, whether they're nonprofit resources in the community, state programs like the PACE program. We're contracted with CMS to provide guide services. If you're not familiar with the guide program, it is CMS pays for respite care for folks with diagnosed dementia or Alzheimer's. And so we deliver services for that program. So wherever there are resources that can help folks receive care that they don't have to pay out of pocket, we are looking to plug them in and help them get those resources. So that kind of rounds out our senior care advisory services. Before I jump into industry updates, I will mention the claims services. So and then kind of what this looks like. So from a claims perspective, a claim management perspective, we do really full service concierge, white glove, whatever you want to call it, support for folks that are referred to us. And we provide that for folks that are preferred to us or referred to us by our preferred partners. And so Buddy Insurance is one of our preferred partners. Being part of the Buddy network, that extends to you, right? That you are part of this preferred family. And so any of those services that I just talked about, whether it's helping folks find the right community, helping them find untapped financial resources. We also do free care planning and free policy review. We'll take a look at their long-term care insurance policy, help them file their claim, whether they receive care with Amada or not. We provide all of those concierge level services for free to those folks that are part of our network. And so that is extended to you by way of Buddy.
And I can attest to that because I have recommended people to Amada and they have done a phenomenal job taking care of them.
Thank you, Gretchen. Yeah, I see the chat box lighting up. I can't see the questions.
It is.
Is there any,
okay.
any questions that make sense to ask? Let me know, Gretchen.
Yeah, Diane had a question. She runs into often caregivers that don't understand how to document their work to be able to get paid. A caregiver may document patient was dressed when they arrived, blah, blah, blah. How do we make sure the people in the houses know what they should be documenting?
Yeah, that is a great question. That's a tough one, right? So as an organization, we go through thorough training with our caregivers and our staff because we do so much long-term care insurance business, right? We know what the carriers are looking for. We know what kind of things need to be noted. We know what ADLs need to be noted throughout the day so that that care is covered and paid for. I'll tell you that the way that many communities invoice is not necessarily congruent with what insurance carriers are looking for. And there is, that is one of the reasons that we end up doing some claims management with communities. But, they'll invoice for, just general care services and then rent, right, for that community. And oftentimes that's not enough information for the insurance company to approve the claim because there's not documented ADL care. There's not documented IADL care. It's not really detailed and showing in the care notes what's taking place, what sort of care is taking place in the note, in those notes. And so, or on those invoices. And so, as you're talking to your clients, it really is, I think you can talk to those providers if they're using a provider that's a community or another home care agency and really talk them through what the insurance company covers and really keep it ADL driven, right? For example, a lot of organizations will document ambulation as an ADL. Well, in the care industry, ambulation is an ADL for us, but it's not when it comes to long-term care insurance, right? And so helping educate them on what the 6 ADLs are that are covered by the insurance company, and educating them on what needs to be documented, right? That two of those things need to be documented on a consistent basis along with those invoices to make sure those claims are approved. There can be challenges there. I know many communities, it's a system, right? And the system has certain options for the caregiver that don't include that. And so it requires an update to the overall system. We use a platform with our caregivers that force them to document all of the ADLs, and the ADLs are definitely include the 6, right? And it kind of guides them so that whatever invoice we send includes care notes that it very specifically addresses those 6 ADLs and the care that's taking place in the home. So that's how we address it. About half of our revenue comes from long-term care insurance. Most senior care agencies, whether home care or senior living, have about 6 to 7% of their revenue. So it's less of what they do, right? And so that creates some of the challenges. But that's a great question, Diane. So as we kind of think about the problem, and this will kind of lead to the opportunity for partnership or deeper partnership with you, right? All of you understand this baby boomer generation and the increase in care needs that's taking place. It's going to put a significant strain on Medicaid and Medicare. The cost of home care has increased dramatically. It actually increased 65% between 2020 and 2024. There is a shortage of professional caregivers. I'm sure you've heard that. If you look at a recent study from Milliman, it highlights not just the tsunami that's coming, but the claims tsunami that's coming for long-term care insurance. I think it was last year, the 16 billion in long-term care insurance claims was paid out. By 2040, it's going to hit I think the ceiling of a little bit over 40 billion in long-term care insurance claims. And so the challenges that we see, not just with care, but also with the claims process, are only going to continue and get steeper, right? As these insurance companies that have significant claims on the books, right, they're going to feel that pressure, and they're going to be looking for ways to minimize their claims spend. And so I think that pressure is going to create more and more of a emphasis on folks requiring folks to be prepared and have knowledge on how to file claims and how to deal with long-term care insurance companies. So I don't want to scare you, but I do want you to have an idea of where we provide value and where we might provide value for you and your network. I just talked about the kind of the increase in costs. If you go back to 2019, these are national averages. A 6 to 11 hour visit on average was about $24.50 for care hourly. That increased by 2023 to $34. Today, it's that national average is closer to $36, 36, 37. So the cost continues to increase. There was quite a bump because of COVID. As you can imagine, COVID put more pressure on home care. A lot of folks were moving home from communities. Skilled nursing facilities reduced their capacity. Seniors, if they could go home, they went home, right, because of the COVID risk. And so that accelerated the pressure on home care, and even more so accelerated the cost. It was also harder for staff, right, to find caregivers that were willing to go and be exposed with that population because of the COVID risk. So that did accelerate the cost, but it hasn't gone down, right? There are caregiver shortages. In 2024, about 60% of agencies had to refuse a client or turn down a client because they did not have the caregivers to be able to service those clients, right? And so that kind of pressure is going to increase. Gretchen
That's
and
a lot.
Wendy.
Can I ask you a question about that's sort of similar? It's actually Wendy's question. Are you finding that more and more carriers are rejecting claims, and that you guys have been able to turn around, hopefully, because Wendy says she has a large book of business, that the carriers seem to be taking longer and longer to process claims and answer questions.
Yeah. Yes, is the answer to that question. We are seeing it's taking longer. We are seeing that there are new measures taking place. For example, for the first time this year, at least it's coming to my attention, right, that we're seeing almost what a model that's been employed with disability insurance, where kind of independent fraud evaluators are being hired to meet with claimants and do recertifications of claims to make sure they're valid. And so there is just more of an intense focus on fraud, waste, and abuse, right? And when you have an intense focus on fraud, waste, and abuse, I think those are all good things, right? You don't want to pay fraudulent claims. You don't want abuse taking place, because that does put more pressure on the claims and on the system. But at the same time, when you employ a lot of those things, it does impact every claim, right? It makes the process longer. It makes everybody go through more scrutiny. And so that is what we're seeing. I think the latest stat I saw is that 60% of families that file a claim without help have some sort of obstacle or challenge the first time, right? And they have to, the insurance company is going to send them a letter. Hey, we need more information. We need more from your doctor. We need more from the provider. And there's some back and forth. And so we have our clean claim process where 99% of our claims go through, they're approved the first time. Right. Wow. And so because we're in the business of doing this and we're processing thousands of claims a month, right, we have that expertise and know exactly what every carrier is looking for to get it to sail smoothly through the process. But even with that, we are still seeing the slowdown. Absolutely. Yeah. That's a good question. I was looking at claims denial data not too long ago, and believe it or not, 2/3 of claims end up being denied because the person dies while they're in the elimination period, which is unfortunate. But it is another reality that claims are getting more challenging, but also people are waiting too long, right, to file their claims. And so one of our messages that I think is good for you to pass along to your clients and those in your network, right, is as soon as you even think you might qualify, right, use your policy. You've been paying for it for 10, 15, 20 years, right? You want to use your policy. You want to make sure it's you get value from it and don't wait too long. I think people sometimes their health can turn really quickly, unexpectedly, and they wait thinking they're preserving their policy, and then they don't end up getting to use it or get the value from it. One of the other things I was looking at recently, and Wendy and Gretchen, this would be good information for you, but also for the group. We have a model because of this kind of turnover rate, right? The industry average is high. Caregiving is a hard profession. It's hard to find caregivers. You're in a constant hiring mode, looking for good people that are passionate about seniors. Our turnover rate is it beats the industry. It's in about the 60% range. But that's still a high figure, right? There's a lot of turnover. But what we are proud of is that so far year to date, we have served about 7,188,000 caregiver hours that have been scheduled, and we fulfilled 7,155,000 of those. So we have a service rate of about 99.6%, which means that if we schedule care with somebody, we're servicing that care. We don't have, a lot of agencies have issues with call-offs and folks are left alone because a caregiver can't make it or a caregiver gets sick. We have a model that has backup caregivers that our agency staff fills in, that we have a lot of levels of backup so that we're fulfilling care whenever we have that obligation. So just to kind of wrap this, right, there's senior care is headed for some challenges, that there's significant demographic growth. COVID has pushed more folks in home. Medicare and Medicaid are going through changes. They are also looking for ways to cut costs. Their biggest cost is hospitalization and skilled nursing, rehab, skilled rehabilitation. And so they are looking to shift as much of that home as possible. And that means as we move forward, hospital stays will be shorter. Skilled nursing and rehab stays will be shorter. And so folks are going to be sent home, right? And so that's going to put even more pressure on the home. And folks are not going to be getting the type of rehabilitative care that's necessary. And they're going to need support when they're home. So this is only going to squeeze kind of this home care, senior care industry even more. Costs are going to go up. As you all know, dementia and Alzheimer's diagnoses are going up. Some of that is because we're living longer, and some of that is environmental, that these cognitive impairment diagnoses are going up. So one of the ways that we're partnering with the industry, and one of the challenges we have for the industry is, hey, as insurers, right? Yes, there are folks that don't buy insurance. There are folks that use our services and pay privately. Right. But as insurers, you're making a promise. And as agents or brokers that offer this to your employer groups, right, you're making a promise of, when you need care, you can utilize your policy benefits and receive care. Well, it's going to put insurers and all of us in this industry in a tight bind, right? If 10 years down the road, policyholders go to file a claim and they can't find a professional caregiver, right? They can't use their policy because of the shortages, and it's really hard to secure care. And so, we are partnering as a network. We are partnering with you, and we are partnering with other folks to say, hey, we will be a dedicated priority network for you if you partner with us, right? And so that's true for Buddy. As you refer clients through the Buddy network to us, they become a priority. We are going to take care of those folks. And so that's our promise to the long-term care insurance industry. I'll talk a little bit more about partner services. Any other questions that have come through, Gretchen?
No, you are good to keep going.
Okay. Well, I will round it out here and then open it for.
Actually, there was a comment,
Mhm.
though. I think it was to the previous, maybe 2 slides ago.
2 slides ago. Okay.
Lisa said, all the more reason not to shun life insurance accelerated benefit riders.
Yes. Yes. Very true. Very true. That's a big part of the equation. And so when I say long-term care insurance, it's becoming the entire umbrella, right? It is individual products, it's group products, it's short-term care, it's even ancillary products. There are some med sup solutions that have home care benefits, right? It's life insurance with acceleration. It is annuities with acceleration, right? It is no longer a one solution answer market, right? There are a lot more solutions. And so it's, do you have an answer to address your aging costs, right? And address that risk. And I think all of those solutions have a part to play. 100%. That's a great point. Okay. Well, I know many of you are on this Thursday call because you're in the group space and you partner with Buddy in the group space. And so really where we look I should say where we partner with Buddy Insurance and want to extend that invitation to you is to use our services and our network, right, to offer your clients and your employers, the employees of those employer groups, right, to offer them holistic senior planning resources through Amada. And so as a agent or a broker, Amada, we have additional resources. We've talked about our partnerships with communities and facilities. We do also have partners that are mortgage reps or elder law attorneys where folks need some level of senior planning, right? That might be even Medicaid trust planning, right? We have folks that we can refer them to if you don't have elder law attorneys in your network, or if their only asset is their home, right? I know reverse mortgages have a challenging reputation, but sometimes that is the only asset that an individual has to turn something into income to pay for care. And so we have those kind of resources in our network. So our offer to you is we are a holistic senior planning agency with all of these resources, and utilize us to connect your members, your clients to these resources for care coordination, financial resource coordination, community facility placement, and claim advocacy. One of the ways you can do that. Oh, you know what? I've got another slide in here. I'll mention also supplemental and pre-long-term care insurance trigger benefits. So I've highlighted or touched on this a little bit as I've been sharing here, but some of the other resources we bring to bear: VA benefits, the Dementia Guide program I talked a little bit about, that pays up to 80 hours annually of respite care with no copay for anyone that has traditional Medicare that is diagnosed with Alzheimer's or dementia. They can qualify. Also, state and local home care programs. And additional ancillary resources. Some of those things like nonprofit connection, even transportation resources, or check-in services. All of those things we can connect families to in the local community. Gretchen, you said something early on that I didn't highlight, and excuse me, my messaging here is getting out of hand. But one of the other ancillary services we do offer, because we have a network of agencies that employ nurses as well, we can provide family caregiver training. And so we can provide hands-on support to family members that want to learn how to bathe someone and dress their loved one, and need to understand the proper body mechanics. We can provide those training resources.
So, John, before you move on,
Yes.
so if somebody in this group, and this was why it was so important for me to have you on today, because the thing is if somebody in this group needs, any of those services, they can tap into that right now. You don't need, there's
Correct.
no like special program that has to be set up. You guys are part of the buddy community, so you can tap into that right now. But also, if you have, a group that you're working with, that, you're selling them on long-term care insurance as a benefit, this is also can be part of that too. So this is just such a huge benefit that that people can just tap into now, right?
That's right. And I'll jump to this next slide, a couple slides ahead here as we talk about that. Yeah, Gretchen, I appreciate that. Absolutely. And so I know at Buddy, you all, talk about our partnership when you're positioning long-term care services with employer groups, right? It is a really, long-term care insurance I should say insurance is a challenging topic, right? Nobody's looking to just add insurance to their platform or individually. They're not looking to add additional insurance or pay for additional insurance. But the power of insurance is where the rubber meets the road. And with long-term care insurance, it's around care, right? And so having something, a ancillary wraparound service that's part of the conversation, right, that employers can offer to their employees today, right? It's not 10, 15 years down the road, 30 years down the road if they're young employees, right, when they go to file a claim. But there are caregiving support resources through Amada Senior Care that you can extend to those employer groups today that their members can tap into, or their employees can tap into. That makes this so valuable, right? And so we have, for example, and this is available through the community partner page of Buddy's site. You can get to Amada, you can see, and there's a button to connect with Amada, and it'll take you to a referral page. And it's this page here. This is our page for Buddy Insurance. This is a simple page. If you're referring a client with long-term care insurance, there was one button. If you're referring a client that does not have long-term care insurance, there's another button. And this is kind of a one use for all of our services. You can refer, and when you do that, there's a simple form with the contact information and for you to describe what that individual is looking for and the kind of support they're looking for. This kind of portal page is something we can develop for you, for your group, for your employer, right? It's something that we can even customize if there's different information you'd like to show up for that particular employer. So this is where, through these customized websites, is where really that benefit is visible, where we describe the benefit and how folks get referred to us.
Right.
So that is kind of what that looks like. I'll pause there. I think that is kind of the meat of how to engage with us and where to offer our services and how to offer our services. Any questions on this?
I did drop the link in the chat, but also, as John mentioned, it's in the portal too. So under community partners. So if you're in the portal, you'll see it right there. Let's see. Do we don't have any other questions in the chat, but I would like to, actually, I do have a question. How do you see, given everything you talked about as far as like where claims are headed, where, where the industry, or where the caregiving realm is headed, what do you see as Amada's role in shaping that future of care?
Yeah, that's a good question, Gretchen. I appreciate it. We are one organization out of many, many awesome senior care agencies, right? You may be familiar with, Comfort Keepers and Home Instead, and some of the large senior care agencies or home care agencies, or your Brookdales or your big communities or Atria Sunrises or some of those. And those are all, friends of ours, partners of ours. I think, like long-term care insurance, the care organizations that really believe in quality and quality delivery, right, are going to be critical to the future of quality care in this country, right? As there is a need for care, there's caregiver shortages, and as Medicare, Medicaid, as CMS has shifted a lot of resources home, they are opening the door for some of the fraudulent activity that has taken place in the healthcare space to come into the senior care space. It's already starting to increase. Some of the changes that CMS has done is they've gone from what was called a fee-for-service model to a value-based model, right? Where in a fee-for-service model, anybody that had a Medicaid contract could submit fees and get reimbursed, and it led to high levels of fraud. Years ago, you saw lots of stories about Medicaid fraud, Medicare fraud. Medicare has gotten a handle on it. CMS has gotten a handle on it by shifting from that fee-for-service to a value-based model where they're partnering with providers to see specific outcomes. So a lot of those actors that were in the healthcare space have shifted and are starting to shift into the senior care space. And so I think our role really is to be one of those voices that raises up quality care, protecting caregivers, and looking out for clients and consumers, right? And so there are other organizations that are doing that as well. I think we happen to be the loudest voice in the insurance industry that is, a senior care agency that is making insurance companies aware of some of those risks and some of those opportunities, as well as BGAs and agencies like yourself.
Right.
So that's kind of more of a
Yeah.
high level, maybe
Yeah.
a
No,
10,000-foot view answer, but
yeah, that was a good answer, because there's just, it is evolving quickly. And so it's nice to know that there are partners like you on that sort of front line, helping facilitate a lot of that change. Wendy,
Mm,
Wendy had another question. Um,
absolutely.
of all the claims that Amada is working on, like in the last year,
Mhm.
who is reaching out for help? Is it the spouse? Is it the
Mm.
family? Who is it that's primarily that key contact? Is it a
Yeah,
child? Is it a spouse? Is it?
that's a great question. Because we have so many connections with long-term care agents and within the industry, we get a ton of referrals from agents. Um, but it is primarily a child, an adult child that reaches out, that initiates a response to care. And it's interesting. One of the things that we see is our huge spikes around the holidays or just after the holidays. And one of the things that naturally happens is that adult kids go home, they see mom and dad, they spend some time with mom and dad, and they see kind of firsthand the reality of what home is like and what some of their mom and dad's limitations are that were not clear over the phone, right?
Mhm,
And so it is often, after those periods of visiting or just becoming aware of some of those challenges, the adult child initiates exploration.
mhm,
And so we're often dealing with an adult child. I'd say, 30, 40% of the time that adult child lives in another state or they don't live close to mom and dad. And so it's a lot of negotiating with maybe a sibling that lives close or negotiating from a distance, right? Of what care can look like and trying to help them find resources.
mhm.
It's more often than not an adult daughter that is, the one managing that care plan. Mhm.
Right. Okay. Let's see. What else do we have
I
here?
will
And
throw up our contact information real quick before
Perfect.
stopping to my sharing my screen. So we have, and from a national accounts perspective, that manage our preferred relationships with agencies and with Buddy and if you reach out and want to build a portal or services directly for your employer groups, you would work with my team. So there's a few folks on the team. You see them there: Krista, Maria, Carson. And if you are interested to talk more, you want to reach out to us, you have any questions, you can reach us at nationalaccounts@amadaseniorcare.com. That'll come to this team, the team of four, and you'll likely get a call from me or Krista, Maria, or Carson. So a little snapshot of what our team looks like.
All fantastic humans. I know them all, so I can attest to that.
Thank you, Gretchen. They're good folks.
They are. Yeah. Yeah.
All right. Well, I'll stop sharing my screen and we can open it up for any last questions, conversation.
I did want to kind of go back to kind of piggyback on the comment of you said when children or family members go back home and they see their parents and go like, oh my gosh, I think that kind of echoes when you said, when should you activate it? Your
Mhm.
policy is sooner than you kind of think. I think
Yeah.
of like my grandparents and stuff, like how they waited so
Mhm.
long because they're, the tough generation of no, I can muscle through it. I'll put my shirt on one arm, kind of the whole thing just
Yeah.
kind
Yeah.
of
Yeah.
persevering and they don't want to take the help.
Mhm.
But that made me also think, when is a great time to get you in front of somebody? Is it when they need care? Is it something maybe like, post enrollment, we're including resources of Amada to people
Mhm.
that have got a policy? So maybe it's in a packet that they go, the brother, or not the brother, but the daughter, the child comes across and goes, oh, there's
A
Amada.
great idea, actually.
I know we have like, like post-enrollment checklists and things like
Mhm.
that. Would that be a good time to include that information?
Absolutely, absolutely. Yeah, many of our partners use our marketing content as a policy stuffer.
Hmm.
Before you go to file a claim, reach out to Amada. In this instance, with employer groups, you can absolutely reach out to us at any point along the way. I think one of the things that folks fail to do is have a care plan, right? Even while they're young and healthy, right? It's you never know when your health can turn, right? And so most folks, I'd say 9 out of 10 families get in a position where the person that needs care has not had a specific plan of action with their kids, right? And so something happens, right? And then all the kids are scrambling to figure out next steps, right? And so there's negotiation between siblings or whoever's the power of attorney. And so setting up a clear care plan is so important. So there's not that confusion in a time that's already really tough, right? And kind of emotionally charged. And so knowing mom and dad's wishes, making sure that plan of care is clear and talked about beforehand is super important.
Oh my gosh, that is such a great point. And Joe, thank you for bringing this up, because we've been talking about post-enrollment communication. Once somebody, we have an employer group or association group, and you have, 25, 50 new policyholders. What do you communicate to them after they have their policy? So I love the idea of including Amada and including reminding them to do an actual plan.
Yeah.
Who does what, who makes what decision, yeah. I love that idea. Yeah.
Well, and I think, depending on the stats that you look at, most employer groups, between 20 and 30% of the employees are to some degree supporting a parent that needs care,
Yeah.
right? And is a caregiver. And so, you hear a lot of conversation about supporting employees that have caregiving responsibilities, but as you offer our services along with long-term care insurance to a group, right? We can be a resource for those employees that have questions for their parents, right? Or older seniors in their lives. And so that definitely is a post-enrollment conversation, right? To say, hey, we have this resource, this partnership available through the network that can support employees as they have these questions for loved ones, right? We don't have to wait till 30 years down the road. We can support family today.
Right. Yep, exactly.
Yeah,
right.
really love that question, Joe. Thank you.
Yes, thank
Yeah.
you.
Any other questions, comments? What you doing for Halloween tomorrow?
Planning on handing out lots of candy.
Yeah. Yeah. All right. I am going to end this call. Thank you so much, John, for joining us today, and for everybody who joined in on this party here. I appreciate all of you for sure, and appreciate the community. And I guess, let's see, our next call is next Tuesday, if you're on the individual side, or Thursday. So look forward to seeing everybody on a call coming up. Thanks again. Thank you, John.
Thank you. Appreciate
You're
it, Gretchen.
fantastic.
Thanks, Joe.
Thank you.
Everybody take care. Happy
Bye.
Halloween.